Hi everybody and welcome to Dr. Helen Allergy. I thought I would just give you a quick overview of what you can expect if you come to see us in clinic. I'm really fortunate that I'm joined by several different members of the team who work with me, and I've handpicked them all because of their experience with allergies and dermatology, but more importantly from my perspective because they are good at listening, hearing your concerns, communicating well and working with you to create a management plan that not only fits the needs of the clinician, the doctor, the nurse, so what we would be hoping to achieve, but more importantly working with you to make a management plan that seems acceptable to you, to be something that you want to work on with us, to look at a holistic approach at managing eczema and skin, looking at what we can do to improve your diet, your gut, as well as looking at what sort of treatments that you need. So you can rest assured that whether you book an appointment with me or one of my team, we will all take great care of you, and we all work closely together and communicate to see if actually one person's expertise might manage the situation better than another. As a GP and an allergy specialist, I myself have a wide range of skills. I've trained for years in surgery and ear, nose and throat before I moved into managing allergies after having experience of my eldest son Ethan having milk and nut allergies. And at that point when he was diagnosed, I realised that despite training to be a GP, I just knew nothing about allergies. And as time has gone on and I've reflected back, I realised that no one shared with me how to manage his situation, how to read food labels, how to prevent allergic reactions from happening, how to recognise anaphylaxis or treat it. So when he first had his first episodes of anaphylaxis, I didn't even realise because it didn't quite look in the way that I thought it would as a doctor. And you know, that's terrible. Thankfully he survived. I didn't need to give adrenaline. He did get better, as is often the way. But I do look back now and sometimes think, gosh, what if? Especially having worked in this job now for a long time and being fortunate enough to have made friends with a variety of people who've been saddened by tragic deaths from anaphylaxis in their family. But it just sort of spurs me on to make sure now that we look after our patients really well, that you get the correct assessment, but that more crucially you get the ongoing support to know how to manage allergies and to look more broadly at what other options are there available for you to see, can we help your child outgrow these allergies? Can we consider immunotherapy? What can we do other than just the routine, just avoid the food? And I can't promise that's applicable to every person, but we certainly will talk about it with you. We can either look after you for the long term, or we can refer you back into the NHS service if we think that this is likely to be an ongoing problem. I'm used to looking after adults and children, and I get just as many desperate families and children coming to see me as I do adults feeling that you have nowhere else to turn. In fact, adults are often very poorly managed and served because the waiting times for adults are really long. Sometimes they're turned down, so you don't get seen because they feel that it's definitely not an allergy, which doesn't necessarily help you, or because they feel it's a condition like mast cell activation syndrome that they can't treat. So usually we ask people to, unless you definitely know you need to see an allergist, to just call us or drop us a query so that we can check that we're the right people for you, because we do want to make sure that we can look after you, and if not, we will recommend who you can go to, and then we can book in and decide who's the best person to see. We can see you no matter where you are in the UK because we can arrange virtual consultations with you. We can send out home allergy test kits or speak to your GP about doing the allergy testing. And so even if you're in an area which is very poorly served, like Ireland or Scotland or even some areas of Wales, or your waiting times are long, then we can work with you to fit you in so that we can get you seen quickly and get you the help that you need. As well as our consultations, we have other ways that you can work with us. We have courses that we develop to make sure you get those skills that you need. We have eczema courses, food allergy courses, gut health courses, courses for your irritable bowel, your histamine intolerances. We have a psychologist to help you, as well as a free online Facebook platform where we really try and come in monthly to answer all the questions, and a great support network, and a closed private membership where you pay a monthly fee, you get a free video consultation with me, and then each month you have a live Q&A from me, our specialist dermatology colleague, a clinical psychologist and dietitians, as well as monthly expert talks and your questions answered every day, just for a small fee. So it really is just like having a full allergy clinic in your pocket. And I know that there is nothing like that anywhere else. So whatever your budget, we can work with you to help you. And to be honest, if you're stuck, just drop us an email and we'll do our very best to support you. It is my real passion to make sure that people can learn how to live well with allergies, to not let them ruin your life. We do that as a family ourselves. All my children have various allergies, and I do. And yet we work through them to find a way to travel, to eat out, to live the life we lead. And I very much feel that's possible for all of you. And if that's the sort of help you want, then you're in the right place.